Well, good afternoon. It's really good to be with you again. Thank you for joining me on this broadcast, whether it's live or whether it's on catch-up. Well, today starts the first of the Scottish Government four-stage step to easing lockdown. So for those who golfers, there are many of those amongst us. I know a lot of them are already on the golf course and will have their tee time sorted. We can also drive more than 5 miles out of our house. Recycling centres will open on Monday. Other exciting things will also happen over the next few weeks, but I think more importantly that we can actually now meet with family we've probably not seen for 12 weeks, and we can sit in the garden and socially distance, but we can still meet 2 households together, no more than 8 people. I think that's just brilliant news. Just shows there is some light at the end of the tunnel. I do think that we have to remember that whilst we're doing all of that, the COVID-19 hasn't suddenly magically disappeared overnight. It's still with us, and we're having to adapt our lives to live alongside it and try and bring some normality back to our lives. It's still going to be really difficult as we go forward. There's still lots of difficult things to do, and it's likely to be with us for a very, very long period of time. I think quite encouragingly, we've also been given the heads up that schools are likely to reopen in some sort of format on the 11th of August. I think every parent and probably every child as well would be delighted to get back to some sense of normality with that routine as well, whilst it will be an element of blended learning most likely for almost every single pupil. It would be really good to get back to that. But whilst we might feel some relief in our personal lives that things are starting to change, for us as an organisation, nothing's going to change just at the moment. So firefighters are working on fire stations and people have been working at home where they can. And both groups of people have faced really difficult and quite tricky situations as everyone has adapted to this new type of normal. Only 12 weeks ago, we were in our offices or in fire stations, we were out and about only 12 weeks ago, and the world's changed in that time. I'm not going to apologise for repeating of how proud, how thankful and grateful I am to you, how proud I am of you, of the incredible effort that you've made in that very short space of time to adapt to this new way of working, and the excellent service that we're delivering to our communities whilst we're doing that, whilst also continuing to do the normal business as usual of a very large organisation that we are. But certainly in the interim, nothing very much else is going to change. So the work on fire stations will continue as it is. We're just starting the extreme high risk home fire safety visits, and they've been started a few weeks ago. We'll continue to do those. But in terms of that lockdown approach and the health and safety instruction, it's not guidance now, it's instruction. Remember that from our last broadcast. We'll continue to stay on stations, and for the foreseeable future, staff working at home will continue to work at home. We've stood down internally, we've stood down our COTAG and our gold arrangements internally, and we've picked the sort of the work of COVID up through the senior management board and the strategic leadership team meeting on a weekly basis where we need to just pick up the decisions. Clearly we're working really hard in the background to apply the guidance that are being produced by Scottish Government to make our workplaces safe. But actually some of that guidance doesn't exist just at the moment. So we're waiting on that guidance, and it will come for later phases. But we're certainly considering what we'll need to do through the work that Paul Stewart is leading for me around, well, whether it's a staggered attendance at workplaces or whether it's a part-time attendance, whether it's one group appear 1 week and then work from home the next week. We're working through these options at the moment. We're working really hard to consider all of the options that would apply so that I can guarantee your safety when you come back into the workplace. One size isn't going to fit all though, it just won't, and we recognise that people's circumstances are going to be different as well. I think there's an added complication that our children will be having some blended learning, so whilst we might be inviting you back into your workplace, you may not be able to undertake that if you have children, particularly school-age children, because you'll have their patterns of being at school, particularly if you have more than one child to accommodate. So We will be as flexible as we can, and we'll continue to be as flexible as we can. All I'd ask from you is some flexibility in return. We're also dealing with the implications of the test and protect. So the Scottish Government's contract tracing principles that went live on Tuesday. It's really early days for that, and there is some concern, and I've expressed some concern yesterday to the Minister and the day before to our Director in Scottish Government about the potential impact it would have on watches and fire stations up and down the country. But it isn't just us, it's the same for Police Scotland, Scottish Ambulance Service, the Prison Service, and the staff who look after our critical national infrastructure. There is the potential at the moment for one person to be infected and to take out a whole watch, potentially the oncoming watch and the offgoing watch, as well as anybody they've come into contact with during the course of that day. So some real significant issues for us. And I've continually raised this with Scottish Government, who are considering what that would look like. And there's guidance being produced by Health Protection Scotland at the moment for that. So in the interim, the instructions that we've given you, particularly on fire stations, have to be followed. So it's the social distancing on fire stations, it is the staggered meal times, staggered break times, not parading at the beginning and at the end of the shift, making sure that you're wearing the right PPE that you've got. There's a hierarchy of PPE in place. And our pod and R&R colleagues will be producing some more guidance this afternoon and next week as we move to wearing face coverings in fire appliances. Because clearly that's an environment that if you're riding more than 4, that you'll find it you cannot social distance. If you're riding 4, you can social distance, and because our appliances are 2.4 meters wide, but we will be wearing face coverings, and those face coverings have been ordered, and I've been updated this morning. They will be delivered on Tuesday next week, and then they'll go out to every single person across the organisation. We're feeling our way in this. It's uncharted territory. No one has all the answers, and often the guidance and the instruction and the advice is evolving on a daily basis, and sometimes a number of times during the day, particularly around the test and protect. Earlier on this week, the guidance is evolving rapidly. As I said at the beginning, we started this 12 weeks ago, and as I've said a number of times all the way through the broadcasts, we will make mistakes as we do this. There's no doubt about it. But where we do, we'll correct them and we'll move on. What we're trying to do is make the best decisions with the best information we have at the time. And as I said, if that changes, then we will change the decision, but we'll communicate that with you and make sure that you know what's going on and that you're aware of the guidance, and you're aware how that applies to your workplace. I want us to find solutions together, and you'll know that's why we opened up a couple of weeks ago the engagement forum, where you can put your ideas in, and there are some topics there, but you can create your own topics. There's been a lot of conversation on there already. It's been open a couple of weeks, and I want to really thank you for taking part in the engagement forum and putting forward some really good ideas. Now, that engagement forum will be open for another couple of weeks, and that will close on the 7th of June. And all the ideas will then be brought together by Paul Stewart. And then there's going to be some engagement forums across the country where we look at specific issues, so focus groups, where we look at specific issues, so that we jointly get to the point where we have ideas about how we can move forward as an organisation. The only way to do this is together. The only way to test things out is together, and the only way to work out whether something moves is to test it and to have feedback from you. And that's really important. There's no point writing guidance here on this and sending it out saying you'll do this, because actually it won't necessarily apply in your workplace. So the intention is to continue to do this together, to evolve the ideas together, to try them out together, at all times being guided by the information coming from Scottish Government, from Public Health Scotland, from the HSE. So one of the things that we were considering just as this pandemic broke was actually what was going to be the future of the fire and rescue service in Scotland. So pandemic broke around middle of March-ish. 12 weeks ago was about the 19th of March. So that was at the point at which we'd undertaken a significant amount of engagement with operational staff around the broadening of the role. And many of you have seen myself and the chair out talking with you in staff groups. We've done Skype sessions for the RVDS throughout the whole of the process. I've been out with the strategic leadership team, answering questions, been on fire stations, engaging with watches about that broader role. And that hasn't gone away. The whole rationale for the broadening of the role was to meet the developing and increasing risk across Scotland. We know that fires in Scotland are falling. We know that our special service related calls are going up. We know that where our partners are seeking our assistance is going up. We know that affecting entry is going up. We know that we're seeing increasing numbers of people where we're stabilising before the Scottish Ambulance Service attend. The expectations from Scottish Government are still the same now as they were at the end of March, as they were at the end of December, as they were in the middle part of last year. And I realised I picked up this journey in January last year when I took over from Ali Hay as the chief. And this has been a journey that we've been on since probably the middle of 2017 in terms of that broadened role and doing more for Scotland. And the terms and conditions element was a really key, important part of that. I think the only thing that has changed from the reject vote from Fire Brigade Union members in Scotland is that there is now no money for a broadened role and a pay deal within Scotland. And I was really clear about that all the way through the engagement sessions, and I think that's even more relevant now. If we look at the cost of COVID-19 to the governments in the UK, it's £300 billion and rising on a day-to-day basis. The cost of providing that support to people who are furloughed is £10 billion a month, every single month, and that's been extended to October. I think we've seen very clearly that there is going to be a real pressure on public sector purse going forward. I don't think even the most myopic of us would see that there isn't going to be a public pressure on the public sector purse. So one of the challenges is, well, how do we do this? So we know that Scottish Government have seen an increase in their money through the Barnett consequentials from the UK Government to support the coronavirus Scotland bill, but that money has gone on supporting business and has gone on supporting health. It's very likely, and it's been already flagged by the Scottish Parliament Information Centre, that the UK Government may revisit UK departmental budgets, and that will be revisiting budgets in Scotland as well, looking to offset the cost of coronavirus against savings from budgets mid-year. Now, the point of me telling you this is repeating what I've already said to you a number of times now, just making sure that we're all in the same place. I don't foresee, personally, this is a personal opinion, I don't foresee over the next couple of years us receiving any more budget than we've currently got. In fact, I would predict us having a reduced budget over the next few years. Now, clearly, I'm working very closely, both the chair and I are working very closely with Scottish Government to ensure that we secure a budget that supports the work that we do. But I'm under no illusions whatsoever that we face a really difficult time going forward. And actually what we do and how we design the service has got to be resilient. We can't do a snap change decision. So that is one of the really important things about getting everyone involved in the post-COVID lessons learned, and actually how we apply things is it has got to be something that can sustain us for the long term. I said at the time of the broadened role, and I'll say again, we have got to continually make ourselves relevant to Scottish Government. You can see this within the legislation, you can see this within the fire framework, it's really clear for you there if you go and have a look at it. But actually we demonstrate our value to the people of Scotland on a year-by-year basis. It's an incredible frustration that we have an annual budget, that we cannot have reserves. If we don't spend our budget, we have to give it back. It means that on a year-by-year basis that we have to work very, very hard to ensure we spend all the money we have. And that will be increasingly more difficult if we have a reduced budget. But both the chair and I are working closely with Scottish Government to set out where we're going to be probably over the next 5 to 10 years. Keeping you safe and keeping our communities safe is going to be the driver, and is the driver at the centre of everything we're doing. as we look forward and look at post-COVID. And again, clearly, none of us really know what the answer is going to be. We're just making plans based on the best information we have at the moment. So in this really difficult time, looking after our mental health and mental well-being is probably one of the most important things that we can do. And you'll remember at the last broadcast, we were in Mental Health Awareness Week, and I asked you to reflect on the theme of kindness and what that means to you and how you demonstrate kindness and how you've had acts of kindness done to you. And I asked you to take part in the conversation and share your thoughts, share your experiences, and a phenomenal number of you took part. It was really incredible to read the stories that you posted on our social media page, whether it's Facebook, whether it was Twitter, or whether it was Yammer. It was an amazing set of stories, but I want to just read one to you, and I'm going to read it to get it right, because it's important. One example I'd share is Lynn Sweeney, who's one of our community safety advocates from the West. Many of you will know Lynn well. At the start of lockdown, Lynn called an elderly lady to give fire safety advice due to coronavirus. The lady is unable to see anyone and had very little family. Lynn has called her every single week for a chat to check in and is planning to meet up with her in a befriending capacity post-lockdown. I think this is great work by Lynn. A wonderful example of kindness in action. And there were many, many examples of that provided by people during Mental Health Awareness Week. And I don't know how many of you took part of who are on the line now. I know there's about 550 people took part in the well-being sessions and also the Keep Fit sessions that were run online. You can now access on HiHub as well if you want to go back to them. You missed out. They were great sessions. And I know our health and well-being team are looking at how they can run those sessions on a more regular basis, because I think this is an important part of physical fitness and mental well-being go together. And actually, we've got to look after both and pay attention to both. And actually, I'm very keen that we support that in the workplace by doing sessions like this, where you can take some time out of your day and you take part in these sessions. And of course, don't forget that our COVID-19 well-being resource is on HiHub and on SharePoint. It's an excellent resource. I think as we've seen the pressures around lockdown and COVID-19 ramp up, and the different how that works out in families and with individuals, we've seen not just within ourselves but across the whole of Scotland an increase in alcohol consumption, an increase in food. There's financial challenges. There's just working from home challenges. There's living as one family in one house without getting out challenges. Information to help you and help you cope and to help you think things through is on the iHub page and is on SharePoint. So I'd encourage you to go and have a look at it. It's a brilliant resource, and I thank the team that have been looking after this on our behalf, making sure that all that information is there for us to support us, particularly during this difficult time. So there's two things I normally do. In fact, I've done every single broadcast is I pay attention to people who've passed during our last, between the broadcast, and also people who've retired. Tom Little, Group Commander Tom Little, retired a couple of years ago. It's his funeral today. And I've sent, and I know so many of you have sent your condolences to Tom's wife and his family at this really difficult time. And I thank you for those people who've paraded today at 10:30 and have sent the pictures into the family liaison officer. And we'll continue as we would do with every single member of the SFRS family who lose a loved one. We'll support them as much or as little as they would like as things go forward. We've also got some retirals to just say goodbye to. So I watched Commander Ian Mackay from Kinross Fire Station retires on Sunday, and he'll have served 32 years, 6 months and 29 days. Thanks very much, Ian. Wish you a really long, happy and healthy retirement. Crew Commander Murray Smith, Jock Smith from driving school in the North Service Delivery area. He retires today. Thanks, Jock. 32 years and 10 months. Best gig in the world. Really appreciate everything you've done, Jock. Again, happy, long, healthy retirement for you. Andy Hunter, Firefighter Andy Hunter, retired this morning, 0800 hours. Phenomenal advocate for the firefighters charity. You'll have see, I don't know, the picture that conjures up in my mind when I talk about Andy Hunter is his fire tunic kilt, and seeing that in New York as he presented a fire helmet on behalf of the firefighters charity, Scottish Fire and Rescue Service, to the New York Fire Department. Andy, wish you a long, healthy and happy retirement. I'm glad you've said to me you're going to come back as a volunteer. I look forward to doing the charity walk with you, and I'm really looking forward to you continuing to work for the firefighters charity. So thank you very much for your dedicated service. There's also Derek Castell, who retired from Newbridge, Watch Commander, retired yesterday. Derek, wish you a really happy, healthy and long retirement. And Group Commander Tommy Sinton, he retires today. He's done 27 years. Tommy, I'll see you downstairs, but wish you a happy, healthy and long retirement, and all of you will be missed. And I certainly know between this retirement, this broadcast and the next broadcast, there'll be Colin Martin, Group Commander Colin Martin, who retired. So the 1990 course that a number of people I've mentioned were on, they're all retiring about the same time. So Colin will have gone as well. So Colin, I wish you a long, healthy and happy retirement. Again, thank you for all you've done for the communities of Scotland. So as with all of the broadcasts, all the recent broadcasts, is a good news presentation to give you a very short one. I think it's really important to just see what people have been doing, what's going on across the service. And I appreciate you sharing those with me so that I can share them with you. I'll show you the video now, and I'm hoping that you can see that. So I'm sure someone will send me a message if you can't see that, because if you can't see that, you're just going to be looking at my face, which isn't necessarily always the best thing to look at. So positive innovation from our colleagues across Scotland. So first thing, it's very unusual that you'll find John Miller with royalty, but John Miller was spoke with Prince William about Lifeline in Scotland about 10 days ago, and you know Lifelines has been set up as a charity to help emergency service workers enjoy positive mental health. So a small number of those workers went with the Prince to discuss the partnership and also the work of the respective organisations. Among those was John Miller, and he discovered the positive relationship between us and the charity, as well as the incredible work that we've put into creating mental health strategy and making sure that we put mental health at the forefront of everything we do. And as you know, that's a real passion of mine, and I'm delighted that we're doing that. And then you can see colleagues from across North Lanarkshire, North and South Lanarkshire. They've launched a series of initiatives to help elderly and vulnerable people during COVID-19. Members of South Lanarkshire Community Action Team, along with 2 colleagues from Clydesmill, delivered prescriptions and food parcels over the last 8 weeks. In addition to undertaking deliveries, colleagues helped deliver 13,000 leaflets to local sites, advertising the befriending work of LEAP and our COVID-19 safety questionnaire. And then to round off the positive work, colleagues in both South and North Lanarkshire have also involved in delivering food parcels to vulnerable armed forces veterans and disposing of excess food bank cardboard. So that's brilliant. What a great example. Thank you very much for doing that. And this is a new one. This is great. 10th of the month, Tracy Ward, in a fantastic work as part of our data performance services team. Tracy is a qualified assurance data assistant based in the West SDA and has worked with us since November last year. Well done, Tracy. Great award. I'm looking forward to seeing more of these awards as the broadcasts go forward. Many of you will know this is Watch Commander Judy Young, and she's teamed up with Voluntary Action Angus to carry out community cleanups, and it's thanks to a multi-agency project to help reduce fire risk during the pandemic. Voluntary Action Angus put together local teams to take to the streets to identify areas of concern such as bins overflowing, fly tipping or rubbish in stairwells. Brilliant piece of work. Well done, Judy. That's excellent. Many of you will have seen this on the staff news with Danielle McGilvery, who called upon a team of young stars to help create fun and informative videos on how families can stay safe at home. It's a great video. I'd really encourage you to watch it. Danielle's from Benbecula, and she set up a task for her son Peter, who's 8, and other children and family friends, some as far away as Glasgow, each undertaking a series of simple fire safety measures. These included testing smoke alarms, ensuring candles are fully extinguished, switching off plugs, and making sure doors within the home are closed. What a great example and a great way to teach our young people how to be safe in and around the home. And then finally for this section, we've already talked about Andy. Andy retired after 30 years. I think Andy was so looking forward to his son passing out. Richard was due to pass out on today, I think it was, and Andy was going to be here on his last day of service, seeing his son Richard pass out, and unfortunately it didn't happen because we foreshortened the recruits course by a couple of weeks. So what was really good is that Andy joined Richard at Sight Hill on VE Day, and the pair stood together to mark a 2-minute silence. I just think that's just fantastic way of just passing the baton between the two families. And they look distinctly similar as well. Anyway, so if we go back to me, so this is the question session. I've got 3 questions I'm going to read out to you, provide you some answers, and I've got some questions that have appeared. I'm hoping they've appeared. I get the right thing. I'm getting better at this. That's better. I've got 16 questions to answer, so let's see how far we get through those questions during the course of this broadcast. So my first question is, when will all hold time and RDS stations be allowed to start off station training exercises again? So as you'd expect, no decision has been made to undertake off-station training at the moment, so we're complying with Scottish Government guidance. The training function are constantly reviewing this, and as soon as we can, we will, but at the moment we can't. When will the next whole-time recruitment likely be? Will whole-time courses be cut short going forward or likely to go back to 14 weeks? So we're planning a whole-time firefighter campaign at the end of the year, but details are yet to be confirmed about the timing of that. No decisions have been made about future courses, and the reason we cut the courses short was because we couldn't have the pass out. So you know how much, all of us know how much work goes into those pass out parades. So they've been cut short because of that. People are coming back later on in the year for those pass outs. So I think it's important that they graduate properly from here before they go to the fire stations. We're continually reviewing the impacts of COVID-19 on our training courses. As you know, we're supposed to have training courses running back end of this year as well. Currently they're under review because one of the challenges we've got is a spirometry test, the blowy test for those who remember it. We can't do that at the moment. We're not allowed to, not just us, anybody who undertakes those tests. So we're constantly working at how we find a solution for that at the moment. And our pod colleagues are working with medical experts to find out what we can do. And then some members of my team at different levels are looking towards promotional opportunities. Has a schedule or order of priority been created for future processes? If so, can you give me an estimated time frame for each? So the pod directorate are currently reviewing the resourcing plan and considering the most effective way to progress promotional processes, taking into account social distancing, of course. This will include confirmation of the schedule of promotional processes, and that's going to be communicated later on in the summer. So they're currently looking at that. This is quite a long question, but this is quite an important question. Following on from the change in legislation in April this year, which prevents RDS volunteer staff from rolling up annual leave for payment at the end of the year, can you confirm what contingencies or alternative arrangements will be made for those who encounter difficulty in taking their full allocation of annual leave during the C-19 pandemic? Many RDS volunteer staff are avoiding taking annual leave in order to continue to meet the demands of the service or have volunteered for additional work in ambulance or whole-time services. I feel that this commitment to the service should be recognised and staff should not be penalised by losing annual leave days or the opportunity to have these paid. I agree with you. So we would expect all members of staff to seek to take their leave in a normal manner. We've talked about this a number of times. Please don't stack it up. It will make loads of problems later on in the year, and we have to maintain a 3-9s response service at all times. We'd expect it to be taken and we'd expect it to be paid, but we're also, in exceptional circumstances where it can't be taken, we'll be as flexible as we can. And also, we have offered, we haven't put the details out yet because we're waiting to see how long this goes on for. We've offered to buy back leave above the statutory minimum, and details haven't been put out that yet, so you haven't missed anything. So we're keeping it under review. We would expect you to take leave, I had one of my SLT off last week, but one off next week. I'm off, I think, the week after that, continuing to take leave. Whilst I appreciate that we're going home to be in the home that we're always in, it's really important to take time away from the workplace as well. I'm now going to go to the questions that I've been given. So having one day crewing appliance, having one day crewing appliance, are there any plans to increase the number, as many stations have similar profile as Livingston? So one of the things that we will have been looking about for a number of years now is actually what the physical footprint of the stations across the whole of Scotland looks like. We're based on a post-World War model. We know Glasgow is a great example of fire stations around the ports. The ports are still there, but the docks aren't, with the bonded warehouses. They don't exist any longer in the way that they were. It's not just there, it's across the whole of the country. So we are looking at what is the best fit for the crewing patterns and the fire stations' physical locations across the whole of the country. And we are doing that. And I would expect that one of the things to consider is moving, using more day crewing type systems or day staffing. That's one of the things that we'll look at. And when we have those details and when we're ready to have that conversation, we'll engage with the whole workforce around this. But that's part of the transformation agenda that the Scottish Government set us in 2016. RRUs were purchased to increase availability and have crews of 3. Well, they don't, they have crews of 4. Is there any future plans to run with 3? Many other UK fire services run similar appliances with this number of crew. So I'm slightly uncomfortable about running with 3s. I come from my home service is Buckinghamshire, and then Hereford and Worcester, which is extremely rural. And having travelled around Scotland, we have additional challenges in terms of the geography and getting appliances to instance. Most of our RRUs are in rural locations for a very good reason. However, that brings with it challenges of getting second or third appliances in. So my intention is not to ride with 3s on RRUs, and we'll continue to ride with 4s. I believe that's the right level of crew for the RRU. Was something we'll keep under constant review. But at the moment, I haven't had any evidence to suggest that we should move from 4 to 3 on the RRUs. Can I just say a big thanks? So this is I'm reading the question out. Can I just say a big thanks to SFRS support staff for working in some pretty daunting conditions, situations over the last 10 weeks due to pandemic? Absolutely true. I also hope they get the recognition they deserve after the pandemic. Completely agree. One of the questions that have been asked of the fire and rescue service, but all of the public sector, is that we consider those people that we would like to formally recognise through the Queen's award mechanisms, so QFSMs, BEMs, etc. There's a whole range of people that we'd like to recognise, from chief officers' commendations all the way through to that. And we're very keen to make sure that we capture everyone that's gone over and above the call of duty during this time. Some people have done some amazing things, but I'm also conscious that there will be people doing amazing things that have not said anything as well. So over the course of the next couple of months, I'm going to be discussing with the strategic leadership team and also the heads of function about how do we do this? How do we recognise the incredible commitment that not only support staff, but staff across the whole of the organisation have made in responding to COVID-19 and supporting the NHS in doing the amazing job that they've done. So yes, there's going to be some recognition. I don't know what it is yet. Some of it will be no doubt formal awards. Other of it will be Scotland only awards. There's also the Brave at Heart awards that we submit people for as well. So there's a whole range, and yes, we will be doing it. So just have a drink and scan this question. It's a long question. So what happens if a watch member reports himself to the government TPI system with symptoms of COVID-19? Do all the remaining watch members then have to self-isolate in compliance with regulations? If this was the case, then it could happen on numerous stations on the same group colour, i.e. white watch everywhere. What contingency plans does SFRS have in place if this is the case? Great question. I covered most of that in my briefing. It is one of my major concerns just at the moment. So the health and safety instructions you've been given, you should be following on fire stations. every single day that you're on the station. If, as part of the government test and protect system, then you will be asked questions about who have you been in contact with. So who have you been within 2 meters of for more than 15 minutes? And you'll tell the government tracing session, the tracer, these are the people, and they will make those phone calls, and those individuals will then be told to self-isolate. Clearly that causes me some problems, because you should be protecting yourself on fire stations, and you should be then in a better place. We're working with Scottish Government and the prison service, the police service, and the ambulance service as to how we do that, so it doesn't just take us out for a period of time, but it also doesn't take out all the emergency service for a period of time, which could be absolutely catastrophic. Scottish Government are alive to that, as are Public Health Scotland, and I'm expecting some specific guidance for emergency service workers to come out imminently. And these are conversations that we've been having all week with all sorts of people, particularly through the strategic coordination group, to try and work that out. So what are the contingency arrangements we have in place? Well, we have an appliance withdrawal strategy, so we can move to that, and it's a very well tested and robust system that uses really reliable data to predict where we should take appliances from. Slightly different to the one we've had before, because we've been working on an information-driven system. We've got 390 day duty staff that we haven't deployed yet, and we've also got volunteers who've volunteered to come back and work for us. So we've got people that we can, and we are starting to look at how we break them down into discrete watches, almost ghost watches, where they can then drop into a fire station or drop with a fire appliance onto a fire station to provide cover. So again, we'll provide strategic cover across Scotland. So degradation policy, as you'd expect for those who've been operational firefighters, we recognise the degradation policy. It's appliance withdrawal, use of RVDS, whether it's coming into crew the station, or whether it's moving an appliance, or whether it's having an appliance strategically placed, and then having people that we can then deploy into a fire station as a ghost watch to crew the fire station for the day and then come away again. So whilst it's not an ideal situation, that was a conversation that the chair and I had with the minister yesterday. We do have some mitigations in place whilst the additional guidance comes out for emergency service workers. Can I please ask why support staff are not allowed to accrue flexi time or toil, but uniform staff are allowed to accrue toil after recent moratorium being lifted? This seems unfair, as many support staff employees are working beyond the normal working week. So this is currently being reviewed, and we'll issue guidance in the next few days. So we're alive to that fact and podder onto that. So I'm expecting guidance will come out probably the early part of next week on that. We've been informed that you have requested an audit of the financial and contractual services by an external company. Is this linked to the comments made in the last broadcast about the potential of whole-time retained volunteer and support staff job cuts next year? So I didn't say there'd be job cuts. I most definitely didn't say that. Anyway, I'll come back to that. And is this the most appropriate time for these comments without more information being provided? These comments will affect people's current mental health with the current crisis and now fear of job losses in the future. So, two questions in there. Yes, we've brought in an external company to provide us a review of our ambition. So you remember the strategic plan we laid before Parliament on the 1st of October last year. That set out our ambitions for the next 3 years. We want to make sure that our technology supports the delivery of the strategic plan. One of the things that we need to make sure is that actually we have decision making and information down to the lowest level in the organisation. I really recognise that we need some assistance with that. So in discussion with the board, we've commissioned an external company to come in and support us with that and provide us some advice and a roadmap going forward, probably over the next 10 weeks, of what that could look like around how we apply technology, how we use what we've got to the best of our abilities. So I'm expecting that report to come out the early part of the summer-ish. It'll then go to the board, and I will share the recommendations contained within that with all of the workforce later on in the year. So you'll see all of that, you'll see what's been said, and be quite clear with that. So what I said in the last broadcast, I just want to pick this person up on this. So made on the last podcast around the potential of whole-time retained volunteer and support staff job cuts. I didn't say that. What I said was, it's likely that we'll face budget pressures going forward. I don't know what they're going to be. And as 85% of our budget is around our staff, then I'm going to have to do something differently about how we crew the whole of the organisation, the target operating model. I can see how you thought that it would be job cuts. If I had less money, or if I have less money, so less money to go around, then I'll clearly look at the TOM across the whole of the organisation, but it won't be voluntary redundancy and it won't be redundancy. I'll be using natural wastage as most organisations would be to ensure that our employment model fits within our budget. And clearly voluntary redundancy or redundancy costs additional money, and it's a pretty difficult thing to do. Unless Scottish Government say that's the thing to do and they'll foot the bill, then we won't be doing it. So I apologise if I've given you the wrong impression. I don't expect this to happen quickly because we can't do it quickly. It's not like we can, it's not like an emergency service is different to everyone else. We have to turn fire appliances out. We have to take 39s calls. We have to statutory requirements to provide fire safety advice. All statutory requirements that need the people in the organisation. So any change to that would be quite difficult to do. And the chair and I are quite prepared and have said this yesterday to the minister and the director the day before that we'll have quite difficult conversations with them about where we currently are as an organisation. So apologies if you felt slightly nervy about that. That was not my intention. As always, my intention is to provide you the information that I have so that you can see the picture that I have going forward. What I won't do ever is spring things on you, and you'll always hear it directly from me. Always face to face as much as I can, as much as this is face to face, of course. With a new test and protect message from the government, this has the potential to cause people contacted through the tracers to be told to go home immediately and isolate. This is the potential to put appliances below minimum crewing during the shift. Absolutely. What is the service putting in place to accommodate this, or are you expecting us to remain on until the end of shift with the possible risk of passing the virus on to another watch? So I think I've answered that. We're working on the guidance. We're expecting some guidance come out from Public Health Scotland. It's caused me immense angst, this, and has taken a significant amount of time for a lot of people to try and work this out. We were slightly surprised at the beginning of the week when this was announced, because there has been work underway on this for a few weeks. But you'll get some very specific guidance around this. At the moment, we will comply with the Scottish Government, the current Scottish Government instructions on this, and then we expect it to be amended slightly for emergency service workers. What is the plan for restarting medicals for whole-time trainees? So I covered this I sort of touched on it earlier on. So our clinical team are working with partner agencies to develop ways to carry out the medicals in a way which keeps our staff and trainees safe. And as you know, if you've been through a medical, that's fairly difficult to do, but they're working on it. As soon as we know how we're going to do it, we'll keep people informed. As I said before, the spirometry test we can't do, and we're working on ways to overcome that and working on with the medical advisors from all the other UK Fire and Rescue Services who also face the same issue. So, question about future potential impact of test and protect on operational staff. Should we now not act and make it mandatory to wear respirators on appliances under 2 meters apart over 15 minutes? The cost of 5 masks is minimal compared to a whole shift needing replaced on overtime. So there's a hierarchy in place. I know that you know this. You will have the first part in the hierarchy, which is a face covering. So it's a cloth mask. And if you look at the HSE Scotland and the NHS Scotland information on this, we're fully in line with that. The next is an IIR mask, which is the liquid repellent one, and the next is the FFP3 mask. So we have task cards on those last two. There'll be a task card coming out on the face coverings early next week. So we're following the HSE guidance, and this is something we discussed with the HSE, and they approved the stance that we're taking around keeping people safe in the workplace. What I've said before, and I'll repeat again, is that on fire stations, you are to follow the instructions that we put out around health and safety. It is not an option. You are to follow that. So you will be social distancing. You will be staggering your meal breaks. You'll be staggering your rest breaks. You will not parade at the beginning and at the end of the shifts. And you will make sure the social distancing, including in the dorms. So all of this information is out there. Please read it. Please apply it. It's been linked into NHS Scotland, Public Health Scotland, HSE, Scottish Government guidance, making sure that we are in line with the best practice advice that's being provided to everyone. So unfortunately, I was paused. That may have been a good thing. It may not have been a good thing. So the question I was asked was, and I'll get that back because I managed to lose that as well. I apologise. Thank Ross for telling me I'd been paused. When you're looking at 2 metre spacing for office staff, will there be a consideration of locker rooms for station and workshops? You can have up to 15 personnel. Most certainly. You can see the challenges we've got, and I'm sure asking that question, you understand the challenges of how many people can be in any one workspace at any one time and what has to be worn by that person. So mouth covering in terms of working within where you can't social distance. And that has been tasked out to the heads of function to consider for all of their teams. And that was tasked out on Monday to look at. As you can no doubt tell, we're pushing people coming back into the workplace further away because we want to make sure it's safe when you do come back into the workplace, whether it's even if it's on a split shift, we want to make sure people are safe. Will we still be looking to create full-time rural watch commander posts due to proposed cuts within SFRS? So we've currently got 78% of the rural and volunteer, the retained and volunteer services covered by rural full-time posts. We're going to continue that rollout. It's likely we're going to delay it to the next financial year because we need to. But in terms of our commitment to the RDS, RVDS personnel and making sure they're supported in the work that they do, particularly in the remote rural locations, we're going to continue to do it. That is a commitment from Ali Hay when he's from Chief, and that continues my commitment as well. There is a significant benefit in ensuring that RVDS personnel are supported, appliances are put on the run, training is done, recruitment's done, retention's done. These are part of our RVDS strategy going forward. Is there a watch commander's process planned, and how are you going to interview with social distancing? So I don't know whether there's a watch commander's process planned. I know Liz Barnes is listening to this broadcast, and I'm hoping that Liz will provide me an answer to that question, and I'll come back to its question 14. You can interview with social distancing using Skype, and I know it's been done, and in fact I'm doing some interviews for operational heads of function in 3 weeks time, and we'll be doing it in a socially distanced way, so you can do it. But I'll come back to you on when the watch commander process is. Can I ask why some managers feel they need to check up on their staff by phoning 2 or 3 times a day? Surely these are difficult enough times for people without the added pressure. So I think there's a balance to be struck between this, between my manager never contacts me, my manager contacts me too many times. And I think that's a conversation between you and your manager. We've asked managers to make sure they check up on all our staff because we don't want you to feel isolated and lonely. Clearly the person that asked this question doesn't feel isolated and doesn't feel lonely. Have that conversation with your manager. Say, thanks very much. I really appreciate you phoning me, but I'm really happy for you to phone me once. And then agree with your manager when they're going to phone you so it works for both of you. How do you propose to implement the broadening role for operational crews when there will be at odds with the firefighter role map and also NJC conditions of service? Or will SFRS attempt to impose these contractual changes, or indeed raid the prospect of 90-day notice letters? So the section 188 notice. Is this the correct stance to be taken when the mental health of staff is already under significant strain? So in terms of the broadened role, if you think of the things that we have done since the end of March, most of the things within the Blunden role, in fact, I would suggest almost all the things and some others that were in the original UK-wide proposal that went to Fire Brigade Union, have been done by the Fire and Rescue Service up and down the country, including in Scotland, over the last 12 weeks. Clearly, we have got to deliver the Blunden role, have a statutory duty in a number of areas. So that will mean that actually we will be discussing with the Fire Brigade Union at some stage what that looks like around ARAs. Now, you know my view on ARAs, but it's a necessary evil in this particular case. But that, unfortunately, what that does mean is that only the people who do the work will get paid for it, which some of you may or may not agree with, but means that the proposal to pay everyone and have a flexible workforce has been taken away. So we have to look at where we can undertake OCCA. So possibly the 19 stations that we had originally were ready to stand up. How we do the extended safe and well check, I think we can do that quite easily because that sits within the current terms and conditions. And then what about OCCA Plus? Well, I think that's a bit further down the road, so I'm quite content around that. What about an MTA response? Again, I think that's a conversation that we have with the Fire Brigade Union at a local level, as we have done a number of things around when we look at ARAs and look at implementing that. So I think it's quite easy to do. It's not about imposing it. I think you all know me well enough by now that that's not a direction of travel that I like. I prefer a willing coalition, and it's certainly not about a 90-day notice. There are ways to do this that actually make sure that we provide Scotland, and that's our responsibility. We provide Scotland with the best response from the Scottish Fire and Rescue Service, working with our partners. And that is what we will do and will continue to do. It's really important. So I hope that's answered your question. Now, so I think I might have missed question 15. I didn't see question. There's no question 15. I have question 14 and question 16, but no question 15. If someone could type me question 15, that would be really helpful. So the answer on the watch commander process, we're currently reviewing our resourcing needs, including the watch commanders, to take account of social distancing requirements. We've been doing some recruitment virtually, and we'll be issuing information shortly in relation to those plans. So that answers that question on that particular one. And in terms of the question 15, which I can't see, excuse me one moment, I just flip between instant messaging screens. Don't need that one. Okay. Question 15. Thank you very much. Thanks, Marisha. The weak point in our operational response and appliance movements regarding social distancing may be whilst travelling in appliances for over 15 minutes, and we will always be within 2 meters. If you're riding more than 4, you will be. Would the instruction provision of face coverings as appropriate PPE now be appropriate to ensure we do not get caught out with the test and trace? If we ensure social distancing on stations, etc., properly, as we are, that's good to know, then I perceive riding on appliances as now the greatest point of risk to lose staff due to the test and trace, as 2 days prior to being symptomatic will be used as a time frame to trace those close contacts. Spot on, great question. Yes, so we'll be moving to face coverings next week. We ordered them. If you remember my last broadcast, I said that they had been ordered. They've now, as with everyone else it seems to be in the UK, want these masks, these face coverings. Our supplier, we ordered 10,000, is delivering over 14,000, which we're really grateful for. They'll be here on Tuesday, and then stores will be getting out as quick as they can to the whole of the workforce during the course of the next week, and probably the week after as well. So that, I agree with you, that is now the weak link for us. Well, I've come to the end of the questions. Thank you for joining me. Thank you for asking the questions. Thank you for sharing your good news stories with me. I hope you have a really good weekend. I hope you, where you can, you've got the ability to go and share it with family. I hope you enjoy the wonderful weather that we've got. If you're on duty, thank you for being on duty during a really quite hot spell. The messages have gone out around the wildfire risk, and I hope that you're not busy. Operations control, thank you for all you're doing as well. I recognise that we talk about firefighters, we talk about people working at home, but Johnson OC is decanted into a very small room at the moment. Thank you for making the best of it. I'm delighted that the builders will be coming back in next week to complete the rework of the Johnson OC. I really appreciate that you've just sucked it up and got on with it, particularly during that first busy spell that we had. So to our control staff, thank you for all the work that you're doing. and making sure that you keep yourself safe as well and healthy, because we really would be stuffed without you. We couldn't. Everything starts with you. So enjoy your day. Thank you very much for joining me. I'll see you in a few weeks' time. Take care.